There's a lot of discussion about the reconstitution of Botox Cosmetic and Dysport, and I just wanted to show our technique for doing this. Everybody has their own ideas about it. I will say there's a couple things that are important. Number one is I believe it's very important that you either label the syringes that you're using Botox with and Dysport if you have both in your practice, or you use different syringes so that it's easily identifiable what is a Botox syringe and Botox Cosmetic syringe and what is a Dysport syringe. So in our practice, what we do is use the BD insulin syringes. We'll use the 0.3 cc syringes for Dysport, and we use the 0.5 cc syringes for Botox. And I'm just going to show this reconstitution with my surgical tech here and medical assistant who assists us with this. And I use a 1.5 ml reconstitution dilutant volume. And again, I would get away from this whole idea of how you dilute your Botox. You're really not diluting anything. You're reconstituting a powder into a solution. So the amount of diluent that you're putting in is how you reconstitute it. I use 1.5, and I like that because of the greater regional effect that Dysport has over what Botox Cosmetic has, and we'll show them both.
Okay, flatten it.
Yes, and we'll just go ahead. You can show the box. Here, he can edit this, but let's just get a shot of showing the box. Now pop it open. So pop it open so they can see it, like your Vanna White. Okay, now pull the bottle out, and then turn the bottle where you can read the Dysport on the camera. Okay, and then do whatever you usually do. Keep in mind, pretend like somebody's looking, start narrating at some point. That's why I'm asking you. He's moving along. We're getting it done. So, okay. So what we're doing is using normal saline, physiologic saline, 0.9%. There's a big discussion about whether you should use bacteriostatic saline or non, and it may sting a little less because the benzyl alcohol. The benzyl alcohol also has the potential to denature a protein. So there's ups and downs to both. We don't have a lot of discomfort with our patients using the saline and the very small syringe needles that we use, so I don't think it's a big issue. We're drawing up 1.5 ml of the normal saline into a syringe using a 19 gauge needle, and then once that's done, we'll pop the top off of the Dysport vial and just slowly let that go in. We don't push it, we don't let it go in like a jet stream because this is a protein. We're gentle with the protein, and we're definitely not shaking the bottle up. We're gently swirling the bottle, just gently swirling it to let it get into solution there. And I think handling the proteins gently is important if you want to keep their maximum potency. And then once we've got it reconstituted with our diluent, we're going to use our syringe. It's open on the other side. We're going to use our 0.3 cc BD syringes, and Mark will show you one of those in close-up here. And that's 0.3. Now, the unit measures on these are insulin units, so they really don't have anything to do with Dysport or Botox Cosmetic. But I do think it's important that we use those units as a measuring tool when we're drawing the product up. The other very important thing we're doing when we're getting these things ready is we're going to pop the top off of the bottle, the vial itself. And the reason I'm doing that is because these are very fine needles. If you really look at these needles, these are very fine needles. I don't know if you can zoom on that, Chuck.
All the way down tight against the deck.
I don't know if you can see how fine that needle is, but it's very, very fine. And anytime you were to push this through, if you can zoom back out now, if you were to push this through that rubber stopper, you're going to dull this needle significantly. And I think what you'll see Mark doing here when he's drawing this up is he's going to be very careful not to bump the tip of this needle into the glass at the bottom, because that dulls the needle. Discomfort comes from big needles that aren't sharp. So we use little needles, and we keep them sharp by not puncturing the rubber and by not touching the glass at the bottom. Now the other thing is that we'll draw these all up. We're not leaving this vial intact. We're going to draw these up to the volume we want in each syringe, and then we're going to refrigerate these syringes with a known amount of product in each one, and I'll talk about that in just a second here. So Mark will demonstrate how he pops the lid off of this thing, and it's a rubber stopper there, and then we'll slightly angle this thing, and I'll hand it off to you so you can do those. And he's going to pull up a few syringes to 0.125 units, which will actually be 12.5 on this. It'll show 12.5 insulin units. That's 0.125 ml. And he's going to draw up some to 25 ml. The 25 ml is going to have 50 units of Dysport. The 0.125 or 12.5 insulin units is going to represent 25 units of Dysport. And it's as simple as that. And I think the care is taken really in drawing this up. And the other part about this is making sure you don't have bubbles or air in the syringe. This is a clear solution, so it's sometimes very difficult to see air versus solution. And obviously we don't want to waste any. But that one was drawn up to 25, which is 50 units of Dysport. And then we'll draw another one up to 25. How many do we do with each one?
Do 4 to 25 and 2 to 12.5.
Okay, so we do 4 up to 25 units, which is 25 insulin units, which is 50 units of Dysport. That's 200 of the 300 total. And then we do another 4 of the 0.125, which is 25 units, and that gives us a total of 300 units. So, and then we have some flexibility. We're using, generally speaking, either 25 or 50 units. Sometimes we'll draw up a little partial syringe of this so we can do little touch-ups if we want. So with the Botox Cosmetic, what we're using is the insulin syringes, again by BD. The difference between it and the last one is you can see that they're 1/2 ml syringes. So you'll see that these can be filled to 0.5. Different syringe, different product. We know which is which. If I came into a room and walked in the door, I could see a syringe on there and say, hey, that's Botox, that's Dysport. So we'll get that going here with the reconstitution momentarily. Cut. I can't remember his first name. The guy down in South Carolina. Okay.
Recording?
With the Botox Cosmetic, 100 unit vials are delivered as a lyophilized powder. That's the bottom. We open that box up. The medication guide, by the way, is on the inside of these things, which is required reading now for patients. And of course, I think including it in your consent form or in posted materials in your office is probably fine. The nice thing about the Botox Cosmetic vials is that you can see that it has a much larger mouth to the vial, which makes it easier to pass the syringe. We'll pop the cap on the Botox Cosmetic vial. And again, I'm not using the small syringes and drawing them through that stopper. What we're going to do is reconstitute using 2 ml of normal saline. And again, I don't have any problem with preserved saline. Some people seem to think it's the industry standard to use preserved saline. And there's some data that suggests there might be less sting. We don't have a problem with sting, so I don't have a problem with using normal saline. And again, it's about how gentle you handle this. This is a protein, so we don't let this thing, it's in a vacuum bottle, so we don't let this syringe plunger just go diving in there rapidly. You can see it goes in slowly. And then we'll gently swirl the mixture. We don't want it squirting in there like a jet. And we'll gently swirl the mixture to make sure that it goes into solution fully. We're not shaking this bottle. You don't want foam or bubbles. That means there's some damage to the protein. And now we're going to pop the lid off of the vial. And again, the important part about this is gentle handling. I don't want to penetrate the plunger, the rubber plunger or stopper at the top of the vial with our small syringe needles, the 32 gauge needle, because it dulls them. Dull needles make for more pain. And then when we reach to the bottom of the vial to draw up the solution, the reconstituted now solution, we're going to be careful not to bump the bottom of the glass. It just goes and touches the bottom, and we're drawing up in this. We'll draw up a series of syringes. If I draw it up to 40 ml, or 40 units of insulin, that's 0.4 ml, I know that there's 20 units of Botox Cosmetic there. If I draw it up to 20 insulin units, I know that there's 10 Botox units in each syringe. So I know how much is in each syringe, and then we'll draw up sometimes some little partial ones with a few units in there for touch-ups or little specialized areas if we need to. Key to this reconstitution, mixing and drawing up, is that you're very careful with the needles and syringes. I think people who keep it in the vial and repeatedly stick the needles in there to draw the product out are really making a mistake in terms of contamination and other issues. It is much better to draw them up into the syringes, keep those refrigerated, than to keep the vials refrigerated. That's sort of our strategy with this. Of course, we're using a fair number of these every day, so we kind of plan the day's activities out, and we're pretty close in what we reconstitute and draw up on a daily basis. Cut.
Okay, so on cue, then just go ahead and place it in there and draw up some solution. Okay. And go ahead, just as you normally would.
And when you're ready, we'll go back to recording.
Okay, good.
Great care with the syringe to just barely touch that needle tip to the bottom of the vial when it's tilted a little bit so that the solution is in one side. And I'll draw up 4 syringes to 0.4 ml, which is 20 units of Botox per syringe, and then I'll draw up 2 syringes that are drawn up to 0.2 ml, which is 10 units of Botox per syringe. And I've got my variation, and then we'll sometimes draw up some little partial syringes that have them for specialized areas. If you're interested in more information on this topic or any of our other topics, please don't hesitate to write at drmaas.com. You can send videos, you can send photographs, or just written text with questions, and I'm happy to answer them. We're more than happy to have you visit our website or visit our Facebook page at facebook.com/Maas Clinic. This is Dr. Corey Maas on Looking Your Best.